everyone, and welcome to the class this morning. We have a few announcements before we get started. My name is Jonathan. I'll be the facilitator for the session. And we would like to thank you all for arriving on time and also remind you that it's important to stay the full hour and also to participate in order to receive credit. If any of you would like to just observe, that would be fine, but please remember that it won't count as a credit. If any of you would like to observe, please let me know by raising your hand right now. It would be important to know because we are at the limit of 20 students. So if any of you aren't going to participate, that would allow for a few more if they log in. Okay, Geraldine. Okay, very good. Thank you. Let me take a note of that. And good. All right, so we can continue with the announcements now. Make sure that you have your chat box open, that you know how to use that. I'll be typing in the scenarios, which you'll need to write down in order to finish the assignment. And I can also give you any relevant medical terms that you might need, or if you need to look up a word, I can give you the spelling. And I also encourage all of you to use the chat box freely during the session. If you have any feedback, any encouragement, or if you would like to write anything that you think would be helpful to the rest of us, please feel free to do so throughout the session. Also, please make sure that you stay muted until you're called on. That way we don't cause any interference. Everybody can hear clearly. If you have any questions regarding the course, any technical questions, you can feel free to attend one of Dr. Lee's question and answer sessions, which you can find on the community page that you used to log into this session here. She has question and answer sessions twice a week, and so feel free to log into those. If you have any questions regarding interpreting in general, or maybe some of the scenarios we go over today, then feel free to ask them after the session is finished, after everybody's got a chance to participate. Also, it's important to remember that in order to develop good skills, we all need to be in the habit of practicing on our own. This is something that even experienced interpreters continue to do. Similar to musicians, that even when they're professional, they continue to practice every day. So that's kind of the mentality we should have. A really good way to practice is by sight translation. And a website that we usually like to recommend using is put in the chat box for you here, webmd.com. So it's good to find an article that interests you and then look at it in English and read it out loud into your target language. You could also do the same with a website that's in your target language, read it out loud into English for practice. Especially if it has both languages, that's good. You can check yourself as well. So, but sight translation is a very good way to practice that we all should be in the habit of doing so regularly. It also gives us a chance to use a medical dictionary to look up any words that maybe we're not familiar with, and this helps us with our vocabulary. It also helps us with the speed in which we can look words up, which is also very important. If you don't have a medical dictionary, there's some links on the website to some really good ones. And if you need one right now for this lesson, a good website that most students like here is lingui.com. It has most of the major languages in it, and it's nice because it gives you context to understand if you have the right word or not. For those of you who speak Spanish, I'll also give you another link here, docmali.com. They have some really good information for medical personnel, especially, well, specifically for those who are interpreting between Spanish and English. It's also very important to have a notebook to assist you in interpreting. So this is something that all professional interpreters carry with them. And it does take a little bit of practice, but it's very important to learn to take brief notes, keywords, numbers. It's important, especially for lists or for numbers. And also sometimes in a real life scenario, the person will go on and on and on. So we need some brief notes to help us with that. During this session, it would be a good idea to practice note taking as you follow along with others as they practice. And also when it is your turn, please remember to refer to yourself in the third person. And that's standard protocol for medical interpreters. It helps avoid confusion since we do speak in the first person as if we were the doctor, as if we were the patient. When we speak about ourselves, we speak in the third person. So we always refer to yourself as the interpreter. And for example, instead of saying, please repeat that, say something like, the interpreter needs repetition. So the same for anything that you would need to request while interpreting. Good. So let me see. We also let me see. Okay, good. We have over 20 students now. Give me 1 second to try and calculate who came in during the announcements. The first one in can still participate. 1 moment, please. Okay, so here, see here, Giancarlos. And let me see also Mahdava. 1 second. Okay, also Wendy. Okay, good. So we did pass the number of students that were allowed to use because we can only go up to 20. So if any of you will be observing who just logged in, I have the last ones to log in then were Giancarlos, Mahdava, and Wendy. Would any of you guys prefer to just observe for this lesson? If so, please let me know. If not, we'll have to, the last one won't be allowed to participate. The question, okay, just want to ask this question. Okay, yes, you could definitely check with Dr. Lee on that. So I understand that you're not planning on participating, Wendy, so good, I'll put you as an observer. For everybody else, there is time to participate. I'm going to give you the keyword right now that you need to finish the scenario. Just because anyone afterwards won't be participating. So glucometer will be the word that we can use today. Good. So let's get started and we'll try to go in the order that you guys logged in on. Okay, so we can start then with Luis. Wait, are we? Yes, Luis. Luis, hello, good morning. How are you doing?
Hello, good morning.
Do we still have Luis with us, Marukin?
Yes, hello.
And it looks like we may have lost Luis. Okay. All right. Somebody just wrote they'll take. Oh, Luis, you are there. Okay. I cannot hear you. Let me see. Can you try speaking again?
Hello, hello.
Okay. Yes. Hello. I apologize about that. I can hear you now. All right. Good. We can start then with the first scenario, and this one here will be a visit, doctor's visit on chest pain.
Okay.
Okay, so good morning. I'm Dr. Martin. Are you Mrs. Jimenez?
Buenos días, yo soy el doctor Martín. ¿Usted es la señora Jiménez?
Sí, soy la señora Jiménez. Buenos días.
Sí, soy la señora Jiménez. Buenos días.
Okay, perfect, but in English?
Oh, sorry.
No problem.
Yes, I am Mrs. Jiménez. Good morning.
Well, nice to meet you, ma'am. And is your pain gone now, or do you still feel it?
Mucho gusto. ¿Ya se le fue el dolor o todavía siente dolor?
No, ahora no tengo dolor.
No, I don't have any pain right now.
And what were you doing when the pain began?
¿Y qué es lo que estaba haciendo cuando le empezó el dolor?
Bueno, estaba durmiendo. El dolor en el pecho me despertó.
Well, I was sleeping and then a chest pain woke me up.
And how long did the pain last? Was it a few hours or a few minutes?
¿Y cuánto tiempo le duró el dolor? ¿Fueron unas pocas horas o pocos minutos?
Eran horas. Lo tuve desde las 2 de la mañana cuando me despertó el dolor.
It lasted for hours. I had it since 2 a.m. when the pain woke me up.
And did you arrive at the emergency room still in pain?
Y cuando llegó a la sala de emergencias, ¿todavía tenía dolor?
Sí, y ahora se me acaba de ir después que me pusieron la medicina en la vena.
Uh, yes, now the pain went away after they put medicine in my vein.
And do you know what may have caused the pain that you were feeling?
¿Y usted sabe qué es lo que habría causado el dolor que estaba sintiendo?
No, no tengo idea.
No, I don't have any idea.
Okay, good. Good job, Luis.
Thank you.
You're welcome. Okay, good. Give me 1 second before continuing. I see a whole bunch of messages here. Let me see if, okay, I see Rebecca. Yes, it is too late. I believe you're after the 5-minute mark, but also after 20 students. So once we get to 20 students, we can't accept anymore. So sorry about that. You're welcome to stay. And as an observer, if you would like, it won't count as a credit. Let me see. And with Wendy, okay, good. Yes, no, hopefully Wendy can get that worked out. But okay, good. We need to keep moving. Okay, you're welcome. So the next student then, we have Vitor. Hello,
Hello.
Vitor. Hello, good morning. Is this your
Good
first
morning.
lesson? I don't think I've met you before.
No, it's because today's a holiday, so I took a day off.
Okay, all right, good. And is your target language Portuguese?
Yeah, Brazilian
Okay.
Portuguese.
All right, perfect. Give me just a minute. I can open up. I have some scenarios prepared in Portuguese. So
Okay.
give me just a second to open that. And all right, so this one here will be in the emergency room, a patient with breathing problems.
Mm-hmm.
Doutor, eu tô com muita tosse. É muito chiado quando eu respiro.
Doctor, I'm coughing a lot and wheezing when I breathe.
And have you seen a lung doctor before?
E você já viu algum doutor de pulmão antes?
Não, ainda não fui.
No, I haven't gone yet.
Well, we're going to have a lung doctor come and see you today then.
Bom, nós vamos ter um doutor de pulmão para vir para te dar uma olhada.
Now, I think some of the wheezing is obviously from the asthma,
Bom, eu acho que esse chiado é obviamente da asma,
but there are probably other things as well.
mas há provavelmente outras coisas também.
Do you take anything for acid reflux?
Você toma alguma coisa para refluxo de ácido?
Okay. Sim, eu tomo.
Yes, I take.
Okay. Good. So acid reflux, there's another expression that's usually used. Can you think of a different way to say that? It would be more similar to, I guess in English, it would be gastric reflux.
Refluxo gástrico?
Bem. Your medical record says that you take pepsin. Is that right?
O seu histórico médico diz que você toma Pepsin. Tá correto?
Sim, eu também tomo omeprazole.
Sim, eu também tomo. Oh, sorry.
No
Yes,
problem.
I also take omeprazole.
Okay, and how long do you take the omeprazole?
Ok, e há quanto tempo você toma omeprazole?
Okay, good. Actually, I messed that question up. I apologize. It was how often do you take?
Ok.
So,
Um,
oh, go ahead.
Ok, quantas vezes você toma omeprazole?
Okay. Meu médico me deu diariamente.
My doctor gave me one daily.
Okay, good. Good job, Vitor.
Thank you. I'm not used to you're the only Portuguese one, so I'm not used to doing the Portuguese English.
All right. No, but that was great. You did excellent with it. So
Thank you.
good job.
Thank you.
All right, you're welcome. All right. So actually, let's go back to the patient then with breathing problems. And let me see the next person to participate. We have Tetiana. Hello, Tetiana. How are you?
Hi, I'm good. How are you?
Okay, good, good. Let's see. We don't have time today for both site translation and the scenario, so I can let you choose if you would like to just do the scenario, or if you would like to try one or the other. So
Yeah, like scenario is good.
okay, sure. So I'll give you both sides in English then. Did you notice any pain before going to bed?
Вы заметили какую-то боль перед тем, как вы пошли в постель?
No, I didn't have any pain before going to bed.
Нет, у меня не было никакой боли.
And have you noticed pain like this when you exert yourself?
Вы заметили боль, когда вы уже проснулись?
For example, when you climb stairs?
Например, когда вы поднимаетесь по лестнице?
Yes, I have noticed some pain when I climb stairs and also when I exert myself a lot.
Да, у меня есть боль, когда я поднимаюсь по лестнице, и также когда я иду.
Okay. Now, there was a word that gave you a problem there. You mind if I ask which one?
Interpreter needs repetition?
Okay, no, I'm sorry, that was me. I should have said this is the facilitator speaking. But no, I was wondering, there was a word that gave you a problem there. Do you mind if I ask?
It's a word exhort, and I just double checked on translation site if I'm correct.
Yeah, okay, good. Yeah, that's a word that does, in most languages, it causes confusion. I'm not sure why, but it does. So, all right, good. That's a good one to keep in mind, though. It does come up pretty often. So,
Yeah.
all right, good. So, continuing, does the pain make you stop to rest?
Боль заставляет вас остановиться, передохнуть?
No, I just continue on. The pain always goes away.
Нет, я продолжаю, и боль уходит.
And what is the pain like? Is it sharp or is it like a pressure?
И какая боль? Она режущая или давящая?
Well, the pain is like a pressure.
Она больше как давящая.
And does the pain get worse when you lay back?
И боль усиливается, когда вы ложитесь?
No.
Нет.
Does the pain change when you move?
Боль изменяется, когда вы поднимаетесь?
Нет.
No.
All right, good. Got one word in there. All right, good job, Tatiana.
Thank you so much.
You're welcome.
Happy for
Okay, thanks.
everyone.
All right. Okay, good. So next we have Rokila. Hello, Rokila.
Hello.
Hello, how are you?
Thank you very much. Thank you.
Okay.
I'm the first time here. That's why.
Okay. Okay, good. I was just going to ask that. So, but you would like to participate, right?
I'll try. Yes.
Yes. Okay, good. And what was your target language?
Russian.
Okay, good. Perfect. So we can continue here. Give me a second. Okay, so the next question then is, does it get worse when you breathe deeply?
Это ухудшается ваша боль, когда вы глубже дышите?
No, I didn't notice any change when I take a deep breath.
Я не заметила никаких изменений при глубоком дыхании.
And can you show me exactly where you have the pain?
Вы можете показать, где именно локализуется ваша боль?
Yes, it's here in the middle of my chest.
Где-то в середине моей груди.
Well, do you notice any difficulty breathing?
Вы заметили трудности в дыхании?
Yes, I often feel out of breath.
Да, я часто чувствую одышку.
And do you notice that your heart beats rapidly or irregularly?
Вы чувствуете, что у вас сердце бьется неритмично и как часто?
Yes, I feel like it jumps around.
Мне кажется, оно как прыгает, как будто сердце.
And do you ever feel dizzy?
У вас кружится голова?
Yes, I do feel a little dizzy.
Да, я чуть-чуть чувствую, как будто голова кружится тоже.
And have you ever fainted?
Вы были в обморочном состоянии?
No, I've never fainted, doctor.
Нет, у меня не было такого.
And does the pain radiate anywhere in your body?
она распространяется по вашему телу, боль.
Like, for example, down your arm or into your jaw.
Например, распространяется на левую руку.
Okay, all right, good. And did you catch the last part of what I said when I said into your jaw?
Oh, I'm sorry, I missed. Она дает на ваш подбородок, ваш подбородок.
Okay, good. No, because sometimes we will cut the person off sometimes, or we start while they're going. So that's what happened there. You started to interpret as I was finishing. So
I'm the first time. I'm just.
yes, no, that's great. You did excellent, especially for your first time. You were very quick and very. It sounded very good to me. But I just wanted to mention that because that's a mistake that does happen, and it's normal. Even an experienced interpreter sometimes will start, and then the person will continue. So just be aware of that, and if it, so if it does happen, that's a case where you would ask maybe for repetition. You could say, for example, the interpreter requires repetition of the last part, and.
Yeah, thank you very much for your feedback. I'm a little bit. How to explain, feel anxiety a little bit because it's the first time.
Yeah, okay. No, you did excellent. You did excellent. So
Thank
good
you.
job, and you're welcome. All right. Good. So continuing now, we have Isaac. Hello, Isaac. How are you?
I'm good, thank you.
All right, good. Let me see. So now the patient answers. Sí, siento el brazo adormecido.
Yeah, I feel like my shoulder is asleep. My arm is asleep.
Okay, good. You got that. So 0 being without pain and 10 the worst pain. How would you describe your pain right now?
Entonces, el 0, que no siente dolor, y el 10, el dolor máximo. ¿Cómo te sientes ahora?
Bueno, 0, ya no tengo dolor, como le dije antes.
Well, 0, I don't feel the pain, like I already said.
Okay. Oh, great. One thing before so it's an older patient, especially with older patients, we need to be careful to refer to them as usted, right? So just keep that in mind, because before, when you're talking about the pain, it was more the two. So just be a little aware of that. But otherwise, you're doing great. So,
Okay.
all right. Have you felt sick lately?
¿Te has sentido enfermo recientemente?
Or do you have any other symptoms?
¿O tienes otros síntomas?
No, me he sentido bien.
No, I've been feeling good.
And are you allergic to any medications?
¿Y usted tiene alergia a cierta medicación?
Sí, soy alérgica a la penicilina.
Yes, I'm allergic to penicillin. Is that how you say it?
Good, yes. So penicillin, you put it
Penicillin.
on the other syllable, yeah. What happened when you took it last?
¿Qué pasó cuando usted lo tomase la última vez?
Did you have difficulty breathing?
¿Tuviste dificultad en tu respiración?
Okay. All right, good. If I can give you one suggestion, study up a little bit on the formal form of speaking, because you used usted, which was great. But like tuviste would be the form of the verb that you use for tú. So like in that case, you would say tuvo dificultad para respirar. So maybe, I know it doesn't come natural if you're not used to using it. So, but it would be worth taking a little bit of time to get figured out. So, but again, other than that, you did great. So thank you, Isaac.
Thank
All right, you're welcome. Good. So next, let me see. Do we still have Carmen with us? It looked like you were having internet problems before. Okay, there you are. So we have Carmen next. Good morning.
Good morning.
How you doing?
Good. How are you, Jonathan?
Good. Thanks. All right. So continuing here then. Now the patient answers. No, me brotó un sarpullido por todo el cuerpo.
No, I got a rash throughout my entire body.
And do you take any medications?
¿Y usted toma algún tipo de medicina?
Sí, tomo un medicamento para el colesterol y uno
Ye-
para la presión.
Yes, I take cholesterol medicine and one for my blood pressure.
And do you also take an aspirin every day?
¿Y usted también toma algún tipo de aspirina en todos los días?
Sí, tomo una aspirina cada mañana.
Yes, I take aspirin every morning.
And do you have any other medical problems besides high cholesterol and blood pressure?
¿Usted tiene algún otro tipo de problema médico además de su alta presión y su colesterol?
No, solo el colesterol y la presión alta.
No, just my cholesterol and my high blood pressure.
Okay, and do you have a primary doctor?
¿Y usted tiene un doctor de cuidado primario?
Sí, es la doctora Álvarez.
Yes, it's Dr. Alvarez.
All right, good. That ends that scenario. We still have a little bit to go, so we can continue. We'll start now with the diabetes diagnosis.
Mhm.
And let me put that in the chat box. Right. Hello, Mrs. Sanchez. It's good to see you.
Hola, señora Sánchez. Gusto en verla.
Hola, doctor. Buenas tardes.
Hi, doctor. Good afternoon.
Now, I have already reviewed the results of your blood tests.
Ahora, ya revisé sus resultados de sus exámenes de sangre
And everything turned out good except for one result.
y todo regresó bien o normal, excepto por un examen.
And that was your blood sugar level.
Y ese fue el nivel de azúcar que tiene.
Okay, good job, Carmen.
Thank you.
You're welcome. Let me see. Next, we have Evelyn. Hello, Evelyn. How are you?
Hello, good morning.
Good morning. Hey, we can continue here. So he continues saying, your blood sugar level was a little elevated.
Su nivel de azúcar estaba un poquito elevado.
I understand that you don't have a family history of heart disease.
Entiendo que usted no tiene un historial de familia de enfermedad del corazón,
But that someone in your family has diabetes.
pero alguien en la familia tiene diabetes.
Sí, creo que dos de mis hermanos y mi papá la tienen.
Yes, I think my brothers and my dad has it.
Okay, ma'am. Well, your elevated blood sugar level indicates that you likely also have diabetes.
Ok, señora, el nivel de azúcar indica que usted también tiene diabetes.
Okay, good. There's one thing, it's a very slight difference, but it does make a difference. So let me repeat that and see if you can catch what it was.
Okay.
All right, so your elevated blood sugar level indicates that you likely have diabetes.
Oh, yes. Indica que posiblemente tenga diabetes.
Okay, good. ¿Cómo es posible eso, doctor?
How is that possible, doctor?
Well, diabetes is an illness that can be inherited.
Bueno, la diabetes es una enfermedad que puede ser hereditaria,
But by eating well and exercising regularly,
pero al comer bien y ejercitarse regularmente,
sometimes it can be controlled.
a veces puede ser controlada.
But when a person gains weight and doesn't watch their diet,
Pero cuando una persona sube de peso y no controla su dieta,
they run the risk of developing diabetes.
tienen el riesgo de desarrollar diabetes.
Okay, good job, Evan.
Thank you.
You're welcome. Before we continue, I see a message. Mahidava was asking, okay, so you were the last one. Give me 1 second here because I believe, so as the last one, you would have been the 21st person to log in. So I believe that is Wendy still here with us? I think because it was okay, no, Wendy isn't here any longer because I wasn't sure if she was participating or not. Oh wait, here she is. Let's ask. Hello, Wendy. I'm not sure if you can hear me. I see you're just logging back in.
Yeah, sorry, I'm just
okay.
listening, but it said difficulties, so log out and log back in, so that's why.
Okay, yeah, that helps if you refresh the page sometimes too. So, I didn't understand before if you were participating or observing.
No,
just
I'll
wanted-
just observe because I'm out walking my dogs and it's
Okay,
too
all
hard.
right. Yeah,
Thank
that's
you.
complicated. You're welcome.
Yeah,
Okay,
thank you.
perfect. So you're welcome. So just to check because you were one of the last ones in. So, Mahadava, yes, you will be the last one. You would have been the 20th student that's participating then. So, good. All right. So now back to the scenario. Next we have Amanjoti Vaga.
Hi, good morning.
Hi, good morning. How are you today?
Good, yourself?
Okay, good. Thanks. So would you like to do the scenario both sides in English, or would you like to try some site translation?
Scenario is fine, thank you.
Okay, sure. You're welcome. All right. Actually, before we do get started, I wanted to mention also for those of you who logged in later, though it was too late. That I see there's a few that have logged in, and I think the past 10 minutes or so. So, okay. All right, good. Now the patient says, I heard that there are two types of diabetes.
मैंने सुना है कि यहाँ दो तरह की डायबिटीज होती है, मधुमेह का रोग।
Which type do I have?
मुझे कौन सी वाली है?
You have type 2, which develops at an older age.
आपको नंबर 2 की डायबिटीज है जो बुढ़ापे में होती है।
And it's associated with weight gain.
ये आपके वजन के मुताबिक होती है।
Oh my goodness, you're scaring me.
हाय अल्लाह, आप मुझे डरा रहे हैं।
I'm going to leave this office running.
Interpreter needs a repetition.
Sure. Let me rephrase that then. I'm going to run out of this office.
मैं इस दफ्तर से बाहर जाने वाली हूँ।
No, you shouldn't be frightened.
आपको डरने की कोई जरूरत नहीं है।
Because you have a case that we can control.
आपका किस्सा ऐसा है कि हम इसको कंट्रोल में कर सकते हैं।
Okay.
नियंत्रण में कर सकते हैं।
Good. We can control it with just a balanced diet and weight loss.
हम इसको नियमित आहार से और दवाइयों से नियंत्रण में कर सकते हैं।
So I don't have to inject myself with insulin like my brother.
So मुझे अपने भाई की तरह इंजेक्शन नहीं लेने पड़ेंगे।
No, we don't have to use medications.
नहीं, हमें दवाई यूज करने की इस्तेमाल करने की जरूरत नहीं है।
Nor injections, not yet if you change your eating habits.
नहीं, इंजेक्शन की कोई जरूरत नहीं है अगर आप अपने खाने पीना बदल लेती हैं तो।
And if you begin to exercise daily.
और अगर आप रोज वर्जिश करना शुरू कर देती हैं।
Okay, all right, good job.
Thank you.
You're welcome. So just to make sure, injection is a word that's used in Hindi regularly?
Yeah.
Yes, okay, good.
Or we
good.
just use say tika.
Okay, all right, good. So so always pay attention, maybe if it's an older patient or from the countryside, maybe to pay attention to which one, or sometimes some words you can also repeat right after the other one. So maybe you could say injection, tika.
Okay, thank you.
No, you're welcome, but good job. That sounded good.
Thank you so much.
All right, you're welcome. All right, so next, let me see. Next we have Charito. Hello, Charito, how are you?
Hello, Jonathan. ¿Cómo está?
Bien. All right, good. Let's continue here. So now the doctor says, okay, ma'am, I will give you some information about a diabetic diet.
O sige, bibigyan kita. Interpreter needs a repetition, please.
Sure. I will give you information about a diabetic diet.
Bibigyan kita ng informasyon para sa dieta para sa diabetes.
And I will teach you how to check your blood sugar level.
At tuturuan din kita para tignan ang sukat ng asukal sa iyong dugo.
And how do I do this, doctor?
Paano kung gagawin ito, doktor?
With a device that measures your blood sugar level.
Isang gamit na susukatin ang asukal sa iyong dugo.
You prick the tip of your finger with a lancet.
Interpreter needs to look out forward.
Sure. Here, I put it in the chat box for you. So it's basically like a small,
like a needle.
Yeah, like a small needle that goes in the machine.
Okay. Interpreter needs a repetition.
Sure. You prick the tip of your finger with a lancet.
Tutusukin mo ang dulo ng iyong daliri ng karayom.
And you obtain a drop of blood.
At kukuha ka ng konting dugo.
You place the drop of blood on a test strip.
Ilalagay mo ang patak ng dugo sa pagsusuri. Interpreter needs to look up a word.
Sure. I can give you the spelling here. It's probably test strip, right?
Yes.
Okay. And actually, the time is up, and we have kind of a tight schedule. So I'll let you take that word down and definitely look it up and maybe take a note of it because it's an important word. No, that all sounded great, though. Good job, Charity.
Thank you.
All right, you're welcome. Good. So next we have Shume. Hello, Shume. How are you today?
Good morning, Jonathan. I'm fine, thank you.
Okay, good. Now, would you like to continue the scenario in English or yes? Okay. All right. Sure. All right. So now he says the device measures your blood sugar level.
这个仪器呢会测量你的血糖。
And how many times a day will I have to check my blood sugar level?
我一天要测几次我的血糖呢？
Well, I would like you to check your blood sugar level 2 times a day.
我希望你能够一天做2次测试。
Once in the morning before eating.
一次在早餐之前。
And once before eating supper.
另外一次是在吃晚餐之前。
And what should I do with the results, doctor?
那我测试的结果我应该怎么弄呢，医生？
You should write down all the results in this small notebook.
你应该把这些测试的结果写下来，在一个本子上。
And you should also write down everything you eat during the day.
然后你还要把你一天吃的东西写下来。
This way you will learn how diet affects your blood sugar level.
这样你就能看到你吃的东西怎么来影响你的血糖。
And how am I going to know when my sugar level is okay?
我怎么会知道说我的血糖是 OK 的呢？
We are also going to give you information regarding ideal results.
我们也会给你一些资料，关于就是正常的血糖。
And what you should do when your blood sugar level is too high.
还有当你的血糖过高的时候，你应该怎么做？
Generally, a glucose level between 70 and 140 is ideal.
一般呢，你的血糖如果在70到100。Sorry, interpreter needs repetition. What's the number? 70 and 100?
Yes, and 140, yes.
OK. 你的血糖维持在70到140的话就是好的。
Okay, great. Good job. And you did very good on making sure you heard the number right, because numbers are very important and they're very easy to mess up. So that was good. Good job.
Yeah.
You're welcome. Let me see. Next, we have Maria Walls. Hello, Maria. I don't believe
Hello.
I've met you before.
Nice to meet you.
Same here.
Jonathan.
All right. Is this your first session or just your first one with me?
Yeah, first one with you.
Okay. All right. So you've gone before, so you know how it works. So.
Yeah,
All right.
thank you.
Okay, you're welcome. All right, let's continue with the scenario here. Actually, let me see. Before is the topic diabetes only? Yes, this was diagnosing diabetes was the topic. So, and then chest pain. Yes. All right. All right. Continuing then. When your blood sugar goes up to 300, you should call our clinic.
Cuando tu azúcar en la sangre suba a 300, deberías llamar a nuestra clínica.
Bueno, doctor, intentaré hacer lo que me aconseja.
Well, doctor, I will try to do what you suggest.
Very good. Then I will make an appointment for you in 3 weeks.
Muy bien, entonces voy a hacer una cita para ti para usted en 3 semanas.
And I want you to bring this little notebook.
Y me gustaría que trajeras esta libreta pequeña.
And please always remember to bring the little notebook to your appointments.
Y por favor, siempre recuerda traer esta libreta pequeña a tus citas médicas.
Okay. Okay, good. Now you caught yourself the first time, but here you let 2 slip out of there.
Yeah, I wasn't sure who it was.
All right. No, so yes, no, it's as a general rule, we're always supposed to use usted,
Okay.
unless it's a little child.
Excellent.
So
Thank
yeah,
you.
so that's you're welcome. No, that's the safest and most professional way to do it. And yeah, so most companies will actually have that as something that they want you to do, and on a test, it's considered correct. So it's definitely good to always use usted unless you're dealing with a little kid. So
Excellent. Thank you.
all right, you're welcome. I'm also going to make an appointment for you with one of our nurses.
También le voy a hacer una cita con una de nuestras enfermeras
That specializes in diabetes.
que se especializa en el diabetes.
And I will also make an appointment with our dietitian.
Y también voy a hacer una cita con nuestra interpreter needs to look up a word.
Okay, sure. There's 2 common choices for
Yeah,
this.
I was going to say nutricionista.
That would be perfect.
Okay.
Yes. You can also, it is correct to say dietética is actually correct, but nutricionista is much more used. So that's what I would usually prefer.
Excellent. Thank you.
All right. Oh, you're welcome. All right. So the time's up. Good job, Maria.
Thank you.
All right. You're welcome. Next, we have Fabiola. Hello, Fabiola. How are you?
Hi, good, thank you. How are you?
Okay, good. Right, so continuing. Bueno, y tengo que ir al laboratorio antes de mi próxima cita.
Okay, and do I have to get blood work before my next visit?
Yes, we are going to do some blood and urine tests.
Sí, vamos a hacerle unos estudios de sangre y de orina.
The blood test is called the hemoglobin A1C. I put that in the chat box for you.
Sí, el estudio de sangre se llama hemoglobin A1C.
The hemoglobin A1C test will indicate your average blood sugar level over 3 months.
Sí, el estudio hemoglobin A1C va a indicar. Interpreter needs to look up a word.
Sure. I'm not sure which one it is. If you need,
It was
go ahead.
average.
Okay, all right, sure.
Va a indicar su azúcar normal entre 3 meses.
Okay, good. So Geraldine gave you a good suggestion. Or the hemoglobina you did kind of say in English, so that's why I thank you, Geraldine, for that. But also promedio is a good way to say average.
Okay, yeah, I like that better. Thank you.
Okay. Yeah. It indicates whether your diabetes is controlled or not.
Indica si su diabetes está controlada o no.
And we are going to do this test every 3 months.
Y vamos a hacer este examen por 3 meses.
Okay, let me repeat that and see if you can
Oh, en 3
catch.
meses, sorry.
Okay, we said every 3 months.
Cada
So,
3 meses.
muy bien. No, it's a small difference, but sometimes that can change, or that does change
Yeah.
the meaning. So, and we want the result to always be below 7.
Y queremos que los resultados siempre estén menos que 7.
Okay, great. Good job.
Thank you.
You're welcome. Let me see. So next we have Jocelyn. Hello, Jocelyn. How are you?
Hello, good. How about yourself?
Okay. Good, good. Thanks. All right. So continuing, we are also going to review the amount of protein in your urine.
También vamos a revisar la cantidad de proteína en su orina.
When the amount of protein in the urine is elevated,
Cuando la cantidad de proteína en su orina es elevada,
it indicates that your diabetes is damaging your kidneys.
eso indica que la diabetes está dañando su riñón.
Está bien, doctor. Hasta la próxima, entonces.
Okay, doctor, that's good. Until next time.
All right, good. So now that ends that scenario, but the next one is still the same patient. So this is the follow-up visit. Okay, so good afternoon, Mrs. Sanchez. How did it go these last weeks?
Buenas tardes, señora Sánchez. ¿Cómo le fue estas últimas semanas?
Creo que bien.
I think well.
And did you bring your booklet with your blood sugar levels?
¿Se trajo su libreta con los niveles de su azúcar?
Sí, doctor. Aquí la tiene.
Yes, doctor, here it is.
And I see that you have lost a little weight.
He visto que ha perdido un poco de peso.
You now weigh 5 pounds less than your last visit, so congratulations.
Ahora peso menos 5 libras. Felicidades de su última visita. Oh, sorry, can you repeat that?
Sure. Well, you included everything, but if you want to repeat it more naturally, go ahead.
Usted perdió 5 libras de su última visita. Felicidades.
Okay, perfect. Sí, leí toda la información que usted me dio.
Yes, I read all the information you gave me.
Estoy tratando de comer comidas bajas en carbohidratos y azúcar.
I'm trying to eat foods that are low on carbs and sugars.
Okay, good. Good job, Jocelyn.
Thank you.
You're welcome. Next we have Angela. Angela. Hello, Angela. How are you?
Good, Jonathan. How are you doing?
Good, good. Okay, so continuing here, let's see how your sugar levels have been.
Vamos a mirar cómo ha estado sus niveles de azúcar.
¿Y qué piensa, doctor, de mis niveles de mis niveles?
And what do you think, doctor, about my levels?
Well, generally they look pretty good.
Bueno, generalmente se ven bien.
But I see that sometimes before eating, your sugar level is a little elevated.
Pero me doy cuenta que a veces antes de comer, sus niveles de azúcar están un poquito elevados.
I see levels over 200.
Veo niveles más altos que 200.
Sí, doctor, no sé por qué se me sube tanto a veces.
Yes, doctor, I don't know why sometimes it goes up so much.
Well, generally it's due to what you eat and how much you're exercising.
Generalmente es debido a cuánto usted está comiendo y haciendo ejercicios.
Ya entiendo, realmente no estabas haciendo ejercicio y encima comí galletas.
Oh, I understand. I actually, realistically, I wasn't really exercising and I was eating cookies.
Okay, that's fine, but if you do that too often, your diabetes will get worse.
Bueno, eso está bien, pero si usted hace eso muy seguido, su diabetes se va a empeorar.
I advise you to exercise daily and not to eat so many cookies.
Mi consejo es que haga ejercicios diariamente y que no coma tantas galletas.
I'm going to make an appointment for you in a few months.
Voy a hacer una cita para que regrese en unos pocos meses.
Entonces, ¿cuándo me toca venir?
So when do I need to come back?
In about 3 months.
Más o menos en 3 meses.
Okay, good. Good job, Angela.
Thank you.
You're welcome. I see, let me see, Rebecca wrote galletas, crackers. Yes, they can be crackers or cookies. So the context, though, with blood sugar made it pretty obvious that they're talking about cookies. So, all right, let me see, continue. Now we have Khalid. Hello, Khalid. How are you? Okay, can you hear me? Let me see. I think you turned your video on instead of your microphone. Let me see if I can.
Sorry.
Oh, there you are.
Sorry about that.
Okay, no problem. No problem. All right, good. Let's continue the scenario here.
Okay.
So now the doctor says, but you should go to the laboratory before your next visit with me.
لازم تمشي المختبر قبل الزيارة.
And I hope that you continue to lose weight.
وأتمنى إنك تواصلي في فقدان الوزن.
Yes, doctor, I will try.
نعم دكتور سأحاول.
Okay, good. That ends that scenario, so we can start the next one. This one is on an orthopedist's visit.
Okay.
So, hello, I'm Dr. Swanson. What seems to be the problem today?
أهلا أنا دكتور سوانسون. ما هي المشكلة اليوم؟
Good morning, doctor. I have a very bad pain here in my waist.
صباح الخير دكتور. أنا عندي ألم شديد في الجانب عندي في جانب البطن.
Okay, it hurts so much that I can't even sleep.
أحس بألم شديد ولا أستطيع النوم.
Okay. So you have a little bit of cough, I can tell, right? Or
yeah, I have a bad cough. A bad
okay,
cold. Yeah.
All right. Okay, well, I'm sorry to hear that, but good. All right, we can continue. When did this come on? When did you first notice the pain?
متى حصل هذا؟ متى آخر متى حسيت بالألم؟
Well, it's been about 2 weeks.
قبل أسبوعين تقريبا.
Okay, all right. That sounded good, Khalid. So
thank you,
and you're welcome. So I hope you get
thank
better.
you.
All right. Okay, good. So next we have Brittany. Hello, Brittany. How are you?
Hello, good morning. How are you?
Okay, good morning. Good, thanks. All right, I can hear an echo, but can you hear me clearly?
Yes, I can hear you. I'm sorry. There's always an echo on your end.
Sure, no problem. All right, so here the patient says, al principio pensé que me iba a quitar.
At first, I thought it would go away.
Pensé que era nada más por cansancio.
I thought it was just because I was tired.
Pero todavía me duele, hasta se ha empeorado.
But it still hurts, and it's even gotten worse.
I see. And can you describe the pain in more detail?
Oh, sí. ¿Y puede describir el dolor en más detalle?
Is it a dull ache or a sharp jabbing pain?
Interpreter's looking up word. Give me 1 second.
Sure.
Interpreter request repetition.
Sure. I'll break that up into the 2 symptoms. So, is it a dull ache?
Es un dolor sordo.
Or is it a sharp jabbing pain?
Interpreter's looking at the word.
Sure.
Jabbing. Well, I don't know. Oh, es un dolor punzante?
Good, perfect.
Okay.
All right. Okay. It's good to have a list maybe of the different pains because these can catch us off guard sometimes, and it's good for reference. So I would recommend having that handy.
Okay.
Es un dolor constante.
It's a constant pain.
Y cuando me agacho para levantar algo,
And when I bend down to pick up something,
o cuando le abrazo a mi hijo, me clava un dolor muy fuerte.
or when I hug my child, it's a very sharp pain.
Okay, good. Good job, Brittany.
Thank you.
You're welcome. Good. So next we have Serge. Serge, hello. How are you?
I'm fine. How are you?
Okay. Good. Thank you. Okay. So let's continue here. I'll give you both sides in English. Does the pain stay right there in your back?
Ese ububabare bushobora kuba buhora buri mu mugongo gusa
Or does it travel to another part of your body?
cyangwa bishobora kuba bijya no ku kindi gice cy'umubiri wawe?
Well, it runs down to my feet and up to the back of my neck.
Rimwe na rimwe uburibwe bushobora kuza mu maguru ariko rimwe na rimwe hari n'igihe buza bukagera ku ijosi.
Sometimes even my brain seems to hurt.
Rimwe na rimwe ubwonko bwanjye busa nkaho numva bundya.
And how far down your leg does the pain go?
Ese ni gute ubwo buribwe bwo ku kirenge bugenda?
It goes up to the ankle, more on the right side than on the left.
Rimwe na rimwe buza ku gice cyo ku kabombogoro bukarya iburyo cyangwa ibumoso.
And it also hurts a lot here, the right knee and the bone.
Interpreter need repetition, please.
And do you have any other symptoms besides the pain?
Hari ikindi kimenyetso ushobora kuba ufite kitari ububabare?
Yes, doctor. When I'm very tired.
Yego muganga, iyo naniwe.
For example, when I go out to run an errand.
Nk'urugero iyo ndamutse ngiye nko kwirukanka.
By the time I come home, my feet are completely numb.
Icyo gihe rimwe na rimwe iyo numva ikirenge cyanjye kiri kumbabaza cyane.
Okay, Serge, that sounded good. So.
Yeah, thank you.
You're welcome. Next we have Irene. Hello, Irene. How are you today?
Hi, Jonathan. Hi, how are you?
Good, thanks. Right, so now the doctor asks, when you feel this numbness in your legs, do you also feel tingling?
그 목 쪽에 interpreter need repetition? Please?
Sure. When you feel this numbness in your legs, do you also feel tingling?
다리에 무감각을 느낄 때 간지러움도 느끼나요?
Okay, good. Now, those are two words that sometimes in a lot of languages are easy to confuse, but they're used very often together. So that might be a good thing for everybody here to make sure we know the difference and can quickly use those two words, because many times they're used in the same sentence. So,
Okay.
right. Okay, you're welcome. Yes, my legs tingle and they also burn sometimes.
네, 제 다리가 간지럽고 또 어떨 때는 붓습니다.
And what about the pain that you mentioned in your upper back and neck?
등 위쪽과 목에 있는 통증은 어떤 종류인가요?
What kind of pain is that?
어떤 종류의 통증이죠?
Well, I'm not sure exactly. It's hard to describe.
표현하기 좀 힘든 통증입니다.
But I would say it's like pounding, beating.
근데 이렇게 약간 뛰는 듯한 그런 통증입니다.
Okay, good. Good job, Irene. Sounded good.
Thank you.
Okay, you're welcome. Next we have Jean Carlos. Hello, Jean Carlos. How are you? Let me see. Do we have Jean Carlos still with us? No, it looks like we may have lost him. If you're here, can you hear me? No, I don't see him on the list. Okay, let me do that. All right, so then we can move on. Then we have Mahadava. Hello, Mahadava, how are you?
I'm good. How are you?
Okay, good, thanks. All right, so continuing here, what brings on the pain?
xanuunka maxaa kuu keenaa?
Well, my waist hurts a lot, and this whole part of my back.
Dhudhunka ayaa i xanuunaya iyo dhabarka gadaal oo dil.
And like I said, my feet also hurt sometimes.
Iyo sidaan kuu sheego kale, lugtana way i xanuunaysaa marmar.
No, but what I'm trying to find out is, when do you feel this pain?
Waxaan rabaa inaan ogaado waxaa waaye goormee ayaa dareenta xanuunka?
With what activities or body positions?
Maxaa kugu kiciyaa markaa qabanayso mase sidaa u fadhiisanayso jirkaaga?
Oh, well, when I bend over, or when I sit or stand for a long time.
Markaan fororsado, markaan fadhiisto, iyo markaan cabaar taagnaado.
And after sitting, when I get up, I can't straighten up properly.
Iyo markaan fadhiisto.
Okay. Can you hear me? I think I may have lost you.
Yeah, I can hear you. Can you hear me?
Okay, good. Yes. All right, let me repeat the last one here. And after sitting, when I get up, I can't straighten up properly.
Markaan fadhiisto oon kacayo, straight uma istaagi karo.
Also, when I put out a lot of effort or when I crouch, that hurts.
Iyo markaan isku dayo inaan wax weyn qabto iyo markaan soo qaloocsamo aad ayay i xanuuntaa.
Okay, all right, good. That sounded good. So, thank you.
You're welcome.
All right, good. So it doesn't look like we have Jean Carlos back yet, right? So, all right. Well, the hour is up, so I thank you all. Let me see. We technically 19 students went, so but I don't see anybody else left that would have wanted to participate, right? Or that made it within the 5 minutes. So okay, good. Well, I thank you all for participating, and yes, feel free to log out if any of you have any questions. Then